Greetings and welcome to In-Depth. I'm Dike Rostant, lecturer in psychology at the UWI and the president of the Caribbean Alliance of National Psychological Associations, or CANPA, Dr. Katija Khan. She recently presented a paper at the CARPHA conference on child and adolescent suicide. Now, this was based on 10 years of data in TNT, but she joins us to speak to these findings and what they could mean for us going forward, in addition possibly to some issues about general mental health. Thank you for joining us, Dr. Khan. Thank you so much for making the time. Now, I want to know, what is it? Because yes, we see things happening sometimes, and yes, there may be information, and somebody might say, hey, it's a good idea to do this. But what's the rationale for actually saying, okay, well, we are going to do this study, and this is even beyond you presenting it at the CARPHA conference?
Thank you for having me, Dike. So first, I want to acknowledge that this research was done with a group of students at the University of the West Indies in the Faculty of Medical Sciences. I do want to acknowledge those group of students as well who contributed to this research. So why this topic? So suicide continues to be a very pressing public health problem for Trinidad and Tobago. Trinidad and Tobago, although our world rankings, and these are not the kind of world rankings that you want to be at the top of in terms of the rates of suicide in the population, although our ranking has decreased in the past few years, we are still third in the Caribbean. We still have the third highest rate, second to Guyana and Suriname. So it continues to be a pressing public health problem. But what is also very troubling is this is not just a problem for adults. We also have children and adolescents who are dying by suicide. And I think that is a great cause of concern, both in the adult population, but also very much so for our young population. So we wanted to look at the data and to see, find out a little bit more about the size and scope of the problem as it pertains to children.
And how do you go about doing something like this? Where do you get your records from, and how reliable is the data? Because I can see the potential for labelings to be a little different because of stigma attached to dying by suicide, at least in Trinidad and Tobago.
So you're spot on. One of the biggest problems in collecting this kind of data is the underreporting, so that there may be many more instances of both completed suicides and attempted suicides that never get reported to the authorities. So if they're not reported, then we're not able to capture that data. So what we can say with a lot of certainty is that the data we have is probably an underrepresentation. Now, there are a number of different sources of data in the country. This study was based on data that was provided by the TTPS CAPA unit, their Crime and Problem Analysis Unit. And so they have been collecting data and we were able to access it. And that's the data we analyzed. On that note, I also wanted to point out that the Ministry of Health, their mental health unit and their Health Psychosocial Services Technical Working Group also has a suicide prevention subcommittee. I'm one of the co-chairs on that committee, and one of the goals for that committee is to look into the various sources of data regarding suicide in the country with the aim of improving the reliability. So that's something that we're working on. So this data, as I said, was collected from the data that the TTPS CAPA unit provides.
Right. And how, when you get that data, how do you put it together? Are there I'm cautious of using the word rubric since a previous conversation with someone else, but how do you take that information and put it together so that it can be consumed by someone who's looking at it after?
So when we get a data set, often it depends on how that data set is organized already. And so CAPA already provides that data in a spreadsheet under categories. So we can identify ages, we can identify gender, we could identify other information relating to the cases, and all of this is anonymized information. So nobody's identifying information is on there. I just wanted to also state that. This is all anonymous information, but we do have different demographics that we can identify and then use to analyze. Now, one of the categories that we were analyzing in this study were the methods used by persons to attempt or complete suicide. And therein lies some of the issues with collecting data, that we do want to have established means of labeling things so that we're able to have consistency, and that when we use a label, everybody understands what that label means. So for this study, we used the ICD-11 labels. And the ICD is an acronym for the International Classification of Diseases. So that's an internationally recognized classification system for medical illnesses of all kinds. And so they have a category that pertains to suicide and self-harm. So we use their categories for labeling the different categories of attempts and methods used. And so what we did was we took the data that we have and sorted them under those categories.
I want to ask about the demographics, because I also want to get into the why and whether or not that was something that was looked at, because sometimes you may have a study that is just quantitative, so you get an idea of figures. Because I'm not sure the scope of the study, was it able to look at qualitative aspects? Because I think knowing why or triangulating that data can also help in terms of trying to mitigate and reduce those numbers, because we don't want to be third on this ranking.
Agreed. So this study did not look at qualitative data, because this was only quantitative data was collected. So in terms of numbers, so we were able to ascertain how many attempted suicides took place, how many completions took place, what methods they used, the spread of ages and genders across the data. But you're asking a really important question. We do want to know the why. And a number of years ago, I also did another study with a graduate student at the University of the West Indies, and we were interested in the why. So we accessed patients who were admitted to the psychiatric ward at Mount Hope, and the reason they were there was for attempted suicide. And we were able, from their case files, to glean some of the reasons that they stated led to the attempts. And the main reason that came up, and this is also consistent with what is reported in international studies, the main reason that came up was relationship problems. And when I say relationship, I mean family, as well as interpersonal, intimate relationships. So that was a big factor in accounting for the attempts. But there needs to be more research. We do need to find out more about why. There is a concept called a psychological autopsy, and it's similar to what you hear about in the medical realm. So an autopsy helps to determine what was the cause of death. So in a psychological autopsy of suicide, what that would involve is speaking to loved ones, significant others, family members, to try and get an idea of what was going on in the person's life and what might have led them to use suicide as a method to cope with whatever they were dealing with. So to my knowledge, we have not utilized this method yet in Trinidad, but it's something we are considering to try and, as you say, get a better idea of what's going on, what are some of the reasons. Now, the other thing that we know is that vast majority of suicides are associated with mental health problems. So people's inability to cope, they're struggling with issues in their lives. So we know that mental health also plays a big role in people's ability to cope, and it might lead to things like attempts.
And we take a pause on the conversation. We take a short break and come back. We're speaking with a lecturer in psychology at the UWI St. Augustine campus, as well as president of CANPA. This is Caribbean Alliance of National Psychological Associations, Dr. Katija Khan. Stay with us. We return after this. Welcome back. We are speaking with Dr. Katija Khan, UE lecturer and CANPA president. And just before we took the break, you were talking about a term that reminds me of something that I came across, forensic psychology. So in terms of psychological autopsy, are they interchangeable, or is one thing, one term more of an umbrella for the other? Take me through that, Dr. Khan.
So the psychological autopsy is similar in that they both have the same purpose, in that we want to identify what was the cause or what were the factors that led to the death. But in the case of a psychological autopsy for suicide, what we're looking at is not a medical reason for what happened, but what were some of the psychological factors and social factors that would have led up to this. And the reason for that is we really want to find out what kinds of circumstances lead people to this course of action. So, and that can help us with designing interventions, with designing prevention programs, so that we can get help to people before they get to that stage.
And I want to talk about some of those programs in just a bit, but how do you prepare, ground, get students into the frame of mind that is able to be objective, is able to approach information like this healthily? Because everyone comes with their own context, some baggage, their own situation. Is it a matter of treating with individuals individually, or is it part of the course or prerequisite before you even get into this, where they're able to deal with some of these heavy issues?
So that's a good question, and it also speaks to, you know, how the university is preparing its students, its graduates, its future researchers, etc. And so the students would have received some level of training with respect to how to conduct research and some of the ethics surrounding research. But I must also say that a lot of this is also driven by students' interests and passion and motivation. Because they could have studied any topic. And, you know, so I do some research in suicide, and so they were also interested in studying that topic. So it made a good fit for us. And so they do a lot of preparation before undertaking the actual study. So they do a lot of reading of the literature to learn about the topic, to learn about how others have studied the topic. And we also have discussions around it. So in our supervision meetings, we have discussions around it. And we will talk through the whole approach and the whole method of what's going to be done. So that gives us the opportunity to discuss any concerns, any questions, and to hone in on what are the appropriate methods that we use, and how do we sustain robust scientific, objective research of a high standard.
A high standard. And looking at the way that the information was already categorized, both attempted and completed death by suicide, what are some of those ways, methods, what are some of the findings that you would have gotten?
Oh, thank you for that. And I also want to put a plug in for organizations that collect this kind of data. It's really critical that this data is available, because then it allows us to do the research and the analysis. So having these kinds of data sources are really important to enable this kind of work to be done. But going into your question, So we looked at data that we had from 2013 to April of 2022. And in that period, we had 177 children, and these are children and adolescents under the age of 19. So we had 177 children and adolescents who either attempted or completed suicides. So we had 65 completions and almost twice as many attempts. We had 113 attempts. Now, when we look at the time period, what that breaks down to is we are looking at approximately one attempt a month and one completion every 2 months. And that's an awful statistic to know that as we speak, we're in 2024, we're in the 5th month of the year, and so we know that we probably have already had about 2 completions or about 5 attempts. Hopefully not. We'll see what that data also looks like. But what is also troubling is that it's the ages that are involved. So when we look at the completed suicides, the youngest age was 9 years old. So that is quite young. And to think of a child in that amount of distress who resorts to such an extreme act, it means that we do have a problem as a society that we need to pay more attention to. With the attempts, the age range, it ranged from 11 to 19 years. So we also have young children that this situation is affecting. Now, when it comes to attempts, what we found was that more females were likely to attempt. However, more males were likely to complete. Okay? Now, this is also very consistent with what we see in the literature on adult suicides, with more females attempting, however, more males complete. And why is that? Why do we see more boys and men dying by suicide? Well, it also goes to the methods that they use. So what we found is that males tend to use more lethal methods, methods that are more likely to result in deaths than females. So that explains why we're seeing higher rates of completed suicides for men than women. So it's not that it's a male problem. This is a problem affecting all the genders. Yeah? But there is an issue with the lethality of the means that men are using.
And 2013 to 2022 means that there would be information from the pandemic. What did that skew the figures in any way?
So what we did notice was a troubling uptick in attempts. So we did see an increase, a significant increase in attempts in the years 2020 and 2021. So because we didn't have all of the data for 2022 at that time, I can't speak to the entire of 2022, but we know that in 2020 and 2021, we saw an increase in attempts. Now, again, while this is troubling, it is not unsurprising because at the beginning of the pandemic, mental health professionals all across the world predicted that it would take a significant toll on people's mental health, and we would see an increase in mental health problems. And I think this data is a reflection of that. The increase in attempts also reflects that people were struggling, including children and adolescents during this time. Now, what we are also very interested in seeing is as we collect and analyze more of the data, so if we include 2022 and 2023, what happens to that trend? So are we seeing a continued elevation, or has it leveled off, or has it started going back down? So that's a really intriguing question that we want to look at because it's very important to know what our current situation is. Are we still affected by the pandemic? Many people would say yes, that we're still feeling the consequences, the brunt of it. It has not yet dissipated. Many things did not go back to to pre-pandemic times. So this is another issue that we want to continue to monitor so that we'll get an idea of what the current situation is.
Thank you so much. And it's almost time for us to go from this conversation, Dr. Khan, but I want to make this space for a quick plug on the Caribbean Regional Conference of Psychology. I think is early June. Who's it for, and what are you hoping to see out of it?
Yes, so in June of 2025, specifically the 9th to the 13th of June, we're hoping that all roads and airplanes lead to Barbados, because that is where CANPA will be hosting our next Caribbean Regional Conference of Psychology, which is being hosted locally by the Barbados Psychological Society. So this conference, while the overall theme is psychology related, this will be relevant to professionals of many kinds in many different fields. So mental health professionals, medical professionals, helping professionals, all manner of professionals who have an interest. The theme for the conference is building mental health resiliencies and empowering our communities. So look out for information on that on our website, wearecanpa.com, and people will find out more information on how to register, how to visit, how to submit an abstract for the conference. And we look forward to seeing many people there.
Thank you so much for that, and thank you for the work that you're doing and continue to do, Dr. Khan, lecturer in psychology at the UWI, president of CANPA, Dr. Katija Khan. And on behalf of the entire TGT News team, this has been In Depth with me, Dike Rostant. Thank you so much for joining us.